Hey, everybody, and welcome to Simulmedia Live. My name is Matt Collins. It's really great to have you with us. We've got a different kind of show today, and I want to begin it with a question. This is a question that is going to bring us straight into our guest. So the question is this. If investing $100 on cultivating health yields $200 in lowered costs and improved outcomes, shouldn't individuals and communities act based on this knowledge? Our guest today, entrepreneur, innovator, leader, and this is the really cool part that I'm sure we'll venture into, trained cosmonaut, Esther Dyson founded Wellville.net to answer this question. So anyone watching this show knows that the people we've had on the program have very typically been what we would call, or what I used to call, or think of as Renaissance men and Renaissance women. But there is no one who I would argue is more Renaissance-y than Esther, our guest today. And Cliff, I'm wondering if you could pull up the slide that just gives an inkling of some of the things that Esther has accomplished in her extraordinary career. If we can pull that slide up. It's just extraordinary. Esther has been, Esther has been an investor. She is invested in some of the really most blue chip types of companies that you can imagine. Companies such as 23andMe, Evernote, SpaceX, Square, and I'm just giving just a sampling of it. She is a current director of Press Reader and Yandex, among others. She's been on several boards, including WPP Group. She was the founding chairwoman of ICON, which is short for the Internet Corporation for Assigned Names and Numbers. This is basically the not-for-profit organization that keeps our internet stable and secure. And she, as I mentioned, she is a trained cosmonaut, and clearly pandemic prepared with a face mask there that presents a bit of sense of humor. And so with no further ado, Esther Dyson, so good to have you join Simulmedia Live, and also joined, as I have been before, by Simulmedia CEO Dave Morgan. Dave, good to see you too. Welcome, both of you.
Glad to be here.
Thank you. Great to see you, Esther.
Likewise. I hear you have a swimming pool up there, even though it's been snowing.
I wish an open one, but hopefully someday soon.
Yep.
Esther, let's dive in and start. We're going to make this very conversational, and I'm going to just remind everyone who's watching this, ask questions. This is going to be a lot more entertaining, a lot more conversational with your questions. So wherever you're watching, if it's on LinkedIn, Zoom, Twitter, there are opportunities there in the window where you're watching this to just fire off a question. We have eyes on all these channels. So feed us your questions. We'll get them into Esther and promise to make this very conversational. But I want to kick it off, Esther, by asking you to tell us, what is Wellville.net? What is its mission?
Okay, well, Wellville, first of all, it's not really .net. It's not, a nice white lady from New York is going to come and help your community use technology. We're kind of like coaches to people in 5 communities, and shout out to any of them that might be here listening. Muskegon County, Michigan, Lake County, California, Clatsop County, Oregon, Spartanburg, the city in South Carolina, and North Hartford, Connecticut. So these were 5 out of 42 communities that applied basically for coaching back in 2014. So we don't hand out money. We don't give people stuff. We don't do the work. We're the coach, just like a sports coach who helps you do the right thing, tells you about cool new equipment, encourages you, asks you tough questions, but fundamentally they have your back and they don't want your job. And so that's what our team of 6 is to the community leaders in these 5 communities that are trying to make them healthier and more equitable places for kids to grow up and people to live.
Esther, how is that different from other health initiatives that are ongoing? Your site talks about taking the long view.
Yeah. So 2 things. One, that great return on investment, it's real, but it's not immediate. It does take time, and you get the most impact from investing in children. It's long term, and you see that impact on kids being healthier and being better parents, and so that really lasts. one way we're different is we're a 10-year project. And we're also a project. We're not a foundation that wants to exist forever. We want to do this, help show it works. And at the end, the communities will have something they built for themselves. We don't give them fish. We don't teach them to fish. We help them to build their own fishing schools. And then our goal is to scale by having other people copy us and to be kind of a role model for other communities. And there's a number of interesting communities that are talking with us about, can you do that with that? No, we won't do it with you. You can do it for yourselves. So it's pretty unusual. And it's a luxury to have 10 years, as you can imagine. So in the middle of it, here comes coronavirus. And the challenge is, how do we take those short-term challenges and actually help them use them to make long-term change? So Dave and I were talking about, when you get $3 trillion in government funds, how can you make sure that, as you know, you need to deal with the immediate problems, but how can you invest it, not just spend it? So if you're going to give people money, invest it by giving them training along with the money. You know, we'll pay you to get trained. We won't pay you to sit around and, I mean this in a positive way, you know, like, people need purpose. And most people would really like to do a job and get paid for it, not sit around and be paid for doing nothing. And then at the end, there's going to be a huge need for healthcare workers, people helping to deal with the trauma left behind, teachers to help the kids who couldn't get to school during however many months it's going to be. And frankly, all the unresolved problems we have left over from before coronavirus, which were communities of color, poor people, bad education, lack of childcare. You know, if we're going to put all that money in, why don't we put it in to train people to do some of these new jobs?
Yeah. So Esther, when you and I spoke about this before, we talked a lot about the unique aspects of more rural communities, and a lot of the ones that you've selected. As you know, I'm from a little coal town in Western Pennsylvania, and I grew up in an area where it's a very different healthcare situation than where I live in the Upper West Side of Manhattan. Normally, though, I'm in the Catskills at the moment, and my mother, my grandmother, and great grandmother were all nurses, and my mother was the chairman of the local hospital. What are the kinds of things that you've seen in places like Muskegon County that are different than what you see in New York City or the Princeton area where you grew up?
Yeah, or Scranton, which was another one of the,
yes. Good hard coal country.
Yeah, in Pennsylvania. I mean, honestly, there's a shortage of healthcare and lack of access to care, but the challenges are much more the stuff that happens before you even get to the healthcare system. It's not food deserts, but food swamps. It's lack of childcare. It's parents who are poor and can't give you the support you need. It's, higher level of adverse childhood experiences, child abuse, again, bad schools, child storage as opposed to child care. And so these people's dignity, children's dignity and self-respect and their ability to learn gets damaged before they even hit school, let alone before they hit the healthcare system. Yes, there's less maternal care and the hospitals are smaller, but it's the issue, people, the damage poverty inflicts on people is not due to a lack of health care as much as it is to a lack of investment in resilience and capacity and education. We need to think of human capital again as an investment, not just something you go out in the market and hire.
So what are some of the areas that you're finding? Like, I'm sure it's not as simple as like a silver bullet, but are you finding some particular areas in your first few years in these projects that you think that are some of the couple of the threads that will really help pull through dealing, solving some of these issues, or at least helping better identify them?
Yeah, so the issues are pretty clear. Take an analogy. You've got a company, and let's say you have 2 or 3 interesting projects. Each of them could make money. They could expand your markets. And, there's some strategic questions and sort of general questions, like should you do diabetes prevention or mental health support or maternal care? But in an actual company, you're also going to say, well, we have exactly the right person to do the consumer facing project. We're really not so good in business. And so in our communities, we focus, let's find the people who are effective and help them be more effective, because effective people have the right attitude. They think long term, they're willing to grow, they're willing to share because they're successful. If you're struggling, you're not going to be interested in collaborating. You won't have the ability to think long term. So we more go after which people are likely to be successtional, because each of the communities really needs all of these things. And
how do you find them? How do you find those effective people?
How do you hire good people? You listen to them, you watch them operate, you ask around. So it's, everybody wants a playbook, and it's just like business. I mean, you can read all these business books about how to do things right, but in the end, you've got real people that you've hired, you've got a real position in the market, you've got a real brand, or, whatever it is. You need to work with the assets you've got. And obviously you can acquire some of them, but it's very much a question of how do you take reality and make it better rather than. So by analogy, there's a wonderful book by Alison Gopnik about raising children called The Gardener and the Carpenter. And the basic message is, your child, don't ever imagine you can construct this child. You have to raise it. You have to be a gardener rather than a carpenter. And in the same way with the community, you can't construct the ideal community with these programs. You have to garden what's there and make it better at being what it was born to be, which is healthy, but defining exactly.
Are you finding themes that are consistent across the 5 markets? I recall once, and I think this is an event you were as well, a DLD event when John Nesbitt spoke, and he talked about how he really became a trend watcher because he started reading newspapers from all across the United States, all sent to him 2 days late. And he started seeing themes when he was working for, I think, President Kennedy at the time on urban planning. He would see some things happening in Detroit and in Miami and in Charlotte. And he could, by having it several days late, he didn't get caught up in what was happening. He would read them out of sync, but he started seeing the same issues. Are you finding the same kinds of things happening? Different growth patterns or stunted growth, I guess you might say, for these gardens?
Again, it's maternal health, childcare, education, discrimination. That it's not just you don't get jobs, but people of color are so much on alert all the time. So, people are rude to people every once in a while, but if you're Black, it's part of a pattern. And that creates hypertension. You end up with diabetes. You have health problems. That makes it harder to work hard. You've got children. If you end up being picked up by the police, you're more likely to go to jail, and then you can't get a job. And so all these things, beyond just plain poverty, you can't afford the best things for your kids, whatever. All those things interact and reinforce one another. And that's the same in each community. The demographics of each community are different, though, typically there's some nice rich people and a whole lot of poor people and a missing middle class and a struggling education system.
We've got Esther Dyson today. I'm sorry, Esther, just real quick. We've got Esther Dyson who is a celebrated entrepreneur and innovator and founder of a group called Wellville. And I just want to remind the audience, if any of you have questions for Esther, just jot them down and we'll get them to Esther. And actually, Esther, I do have a question that's come in from the audience. And this comes from Evan. And Evan wants to know, did your work in technology prepare you in a special way for the work that you're doing today? And a follow-up to that is, in what ways is the work that you're doing now similar or different relative to running or investing in startups?
Yeah, I would say more probably the thing that trained me the best was working as a journalist, as a reporter, because it makes you unafraid to ask questions and to just keep pushing till you get an answer that makes sense. And that helped me when I was doing tech. It helped me when I was working on Wall Street. It certainly helps me at Wellville. Uh, you know, some people feel if they ask a question, they look stupid. And I'm just more interested in finding out the answer. My parents were both scientists. Tech specifically, it's good to know what's available. It makes you understand how fast things can change. It gives you that sort of entrepreneurial spirit, but it's the subject matter is not as important as that basic attitude of, my favorite saying is always make new mistakes. Try something, see if it works. It won't, but you'll learn something. And you tend to learn more from your failures than from your successes, because in both cases, if you're successful, maybe you were just lucky. So you don't really learn what worked. You learn, oh, I was lucky, I must be really smart, as opposed to, this is what I did wrong, and now I can learn how to do it better.
So Esther,
can you go ahead, Dave?
Yeah, I was wondering, you were certainly very, one of the reasons that you've been so successful is that you've made so many other people successful, and that people would track the things you were writing or your analysis, and they recognized that you were identifying really big themes that fundamentally changed, technology and business. And one of those was around the open source movement. And in the more you share, that actually it's not just better for everybody in the markets and the ecosystem, but it's better for the individual companies and players that share more information, whether it's medical information, whether it's business information, proprietary, or is that some of the kinds of themes that you're looking at in Wellville, that you don't need to do 50 markets if you can do 5, because copying is a good thing. It's not a bad thing.
Yeah, totally. I mean, so I would meet entrepreneurs and they would say, oh, I have this secret thing I'm doing and blah, blah, blah. And I would always say, dude, you don't get it. Your problem is not keeping this secret. Your problem is persuading people that it's good in the first place. And that's really what we're trying to do. We're trying to show that this works. And it's hard because, it's slow. And in theory, everybody knows this stuff works. I mean, they've done enough studies and followed things and so forth, but people are inherently short term, and they, it's the instant gratification, the marshmallow, that, the advertising, I got to go buy this thing that I saw on TV because it's going to make me popular. And we're trying to get people to think farther down the line, what do we want this community to be? We don't just want to feed people. We want to give them the capacity to feed themselves. We want the children to be able to get jobs, and everybody sort of knows that, but they keep forgetting it in the hustle of trying to live day to day. So, in the same way, they know that they're not really going to lose anything if someone else does it too. But it's, again, and I mean, ironically, also in our communities, people say, we're going to give you this app for free or this thing or that thing. And what they don't realize is you need to sell the app. You need to persuade people to use it. It's not enough to make things free. People actually need to understand that they need to invest along with the creator of the app in using the app.
We've actually got another question from the audience.
Okay.
A couple of questions have come in. So Patty wants to know, will the basic constructs of the community health worker system assist with Wellville? And so maybe as you answer that, Esther, if you can tell us what the community health worker system is.
It is, I mean, this is what I was talking about when I said I want people to invest in training workers. Something that's so much more effective than an app is someone who has your back, who calls you up, who, after coronavirus comes and visits you, and coach, we're coaching the leaders in these communities. If we had the capacity, we would coach every resident in the community. And, if half the people in this country have their jobs automated and those people go to work helping the rest of the people be healthy, it would be a much better world because they would have meaningful work. The people they worked with would be healthier, and meanwhile, the robots would create all the stuff we need. I mean, what a great world. But those human connection jobs, whether it's salesperson or a barista or a healthcare worker, those are the people that actually help people, healthcare workers, improve their behavior versus the doctors who just give you the pills and do operations. So much of health depends on how people behave, but it's not a question of tell them how to behave. It's a question of getting them to do it for themselves.
Thanks, Patty, for your question. We've got more that are pouring in. So thanks to all of you who are asking this question. And I love this question. I think I know the response that it's going to get, but I'm very eager to see where this takes us. Lou says, hi, Esther. What has to happen for New York City to become a Wellville community?
It has to do it for itself. It's open source. We can do it, but we do need, again, we need to invest all those funds in training healthcare workers, in training teachers. I mean, it's so wrong-headed to lay teachers and healthcare workers off. If we're going to spend all this money, spend it on funding those people and spend it on funding fund the trainers that train the trainers. Don't give people money to sit at home and feel useless. Give people money to get training, to improve their dignity, to feel that they're needed and wanted, and give them the capacity to actually be useful. That's the real magical transformation that we could do with COVID-19 if we do it right, even in New York City.
So there's nothing about the size of a community that would prohibit it from taking on this playbook. I mean, what we talked about, Dave talked about, and you talked about the notion of open sourcing, and so it could apply.
It totally could. The reason we picked small communities is because we're small and we can coach only a limited number of people, and so the real story is in 2013 or 2014, somebody peed into a reservoir outside of Seattle. And for some reason, it was caught on a video camera, and it was, oh my God, somebody peed into this reservoir. And anybody in healthcare would say, well, birds do that all the time. It's not really that terrible. It's a very big reservoir. But anyway, our idea was we would instead of peeing, we would put rose water into a bathtub, not into a reservoir. So we wanted communities that were bathtub sized rather than reservoir sized, just so that you could see the impact more quickly. I mean, the reality is New York is a bigger problem. It also has much bigger resources.
Is there an experiment, Esther, that you're aware of, or an engagement in one of the W5? That's the acronym for the Wellville 5 communities. Is there a work that you've done over these last 10 years that especially comes to mind as an example of effectiveness in long-term thinking and planning?
Yes, but first, just honor compels me. One of the things that really didn't work was I had this idea that we should improve the vaccination rate for flu long ago. And I kind of forced it to happen. I got some people from Walgreens to help and so forth, but in the end, it wasn't the community's project, it was mine, and it had no visible impact. So from that, I learned partly, just let people do it for themselves. And the thing that I'm probably proudest of in some way is the YMCA, the Muskegon YMCA's Diabetes Prevention Project. We were talking about it, and I asked them, so what could you do if you had enough money to do whatever you wanted? And they said, well, we could hire a couple more counselors. And so Muskegon has 180,000 people. which means they probably have 30 or 40,000 pre-diabetics statistically. And one of the problems is so many people don't even know they're pre-diabetic. And I just asked, I didn't tell. But imagine you had all the money you needed and 30 or 40,000 diabetics, what could you do then? And, again, it's not that I did this, but I think it got them thinking, and they ended up, it's a long story, but they got a multi-million-dollar grant along with the Trinity Healthcare System from the CDC. And now they've got their first 1,000 people, and they're heading to more. They're obviously offering it online, but it's like, it reminds me of another of the communities. We asked them, one of their goals was to address suicide prevention. And my question was, well, don't you want to just prevent suicides rather than address it? And it's changing that thinking, and it's starting to happen in each of the communities. In Lake County, they were going to do a dashboard at some point, and now with COVID-19, the health dashboard is up there. People can see the numbers, they can see progress, they can see all the unaddressed problems of diabetes. In each community, they've become more conscious, more long-term thinking. They're beginning to see the huge inequities between the rich or the minority populations, and the numbers may look pretty good, but there's a huge disparity between the top and the bottom in each of these places, as there is pretty much everywhere in the U.S.
We're coming up on the end of the time here. We've got just a couple more questions that have come in. Ricardo has asked, what type or classes of metrics are you looking at in terms of assessing the progress or lack thereof per city in the Wellville Initiative?
Okay.
And thanks, Ricardo. That's a great question. It
is. And we thought it would be so easy. We'd just pick 5 metrics and then we'd be done. But it starts with things like transitions to diabetes, or projected lifespan, and access to childcare, all kinds of rates about neonatal intensive care use and healthy births and so forth. But the ones that really excite me, and I think excite lots of the community, are things like high school graduation rates, reductions in jail or crime, the things that people really care about. I mean, ultimately, we want people to say, oh yeah, Muskegon, I've heard about, that's where I want to go live. Or I left Muskegon to go to college, but now I want to come back because I love this place. And so, it's just like selling a product. You have the product specs, but what people really want is this product to make me feel good, or good looking, or healthy, or is it going to increase my capacity, whatever. So we look at all the kind of standard health and healthcare metrics, but ultimately our success is going to be when a real estate agent says, I got to open a new office and hire 2 more people because all these people are moving in. And that's what really matters.
Esther, this has been fantastic. I'm curious, Dave, as you've been sizing all of this up and listening to this and reflecting on your own background and your childhood and upbringing, a lot of people who live, especially in coastal communities, tend to write off places like where you grew up or Muskegon. I grew up in Michigan, closer to Detroit, but a lot of people tend to write off those communities. As you reflect on the work that Esther is doing, Dave, does this make you feel more optimistic about the viability of some of the small town communities of the kind that you came from?
Certainly. And I'm just thinking, particularly the last comment you just made, Esther, and the answer was, I recall, and I think this is probably at some point in the middle 1980s, some magazine or someone named Pittsburgh the greatest place to live in America. And for all of those from Western Pennsylvania, or anyone that had an image still in the 1980s, Pittsburgh was the place where they had the steel mills and the coal dust and smoke, and it was like the most awful place to go to. But obviously, after the collapse of the steel mills in the 70s and early 80s, there was a lot of rebuilding, a lot of focus on technology and medicine actually there. And by the late 1980s, it had truly become a very different kind of place. And now people go, now 20, 30 years after that, and you can see it's a very revitalized, very different kind of city than anyone knew it then. And everyone talks about how beautiful it is. And I think that it's interesting. I think having goals like that, because those are really the things that matter. Will people move their families there? Do they want to raise their families there? And I think finding ways to change some of the structural things, I think it's that so much resonates with me, because giving people a chance. I think you talked, Esther, about dignity. If there's anything that I find that sort of undermines everything I know in my hometown, in my area, you almost always find dignity in the middle of it. That people are like, why are you doing that, or why didn't you do that, or you should have this, or the amount of not having something to do every day to make a difference because something's been given to you or taken away from you. And I think finding ways to give dignity in these communities and hopefully taking out the irrationality. I was speaking with my mother recently, and the hospital system that controls the hospital in my town now it's a new, not very well capitalized for-profit hospital system with 6 or 8 small hospitals in Pennsylvania. And because they have to be prepared, they have no elective surgeries now because they have to be prepared for COVID patients, which really aren't there yet. They just had to lay off 600 people across 8 communities, doctors, nurses, administrators, because they actually don't have a system that can sort of balance either it's one or the other. It's like have everything available or not, and they weren't capitalized correctly. And it's sort of like, I think, as you say, Esther, why don't we give the money to people like that to do the kind of training? So it's a lot of really things, but I'm very optimistic. I believe in humanity and the human spirit and the human condition. And I think that the more we can find some of these answers and lift them up and show them to people, and I'm confident you will, Esther, just as you've led the way for decades in so many of these areas. And because the things you have seen early created wealth in so many others, I'm sure a lot of people are watching and saying, let's watch Esther, let's see what she does. There's going to be a lot of disruption and transformation in business, not just in obviously healthcare, but in healthy living and in education and all of these kinds of things. And so I'm very optimistic. If you're there, Esther, it's going to change and make a difference.
And I'm really glad to have had the opportunity to talk about this with you and your audience. So thank you.
And, thank you, Esther. Go ahead. Sorry, finish your thought, Esther.
I look forward to seeing you face to face.
Yes, me too.
Esther, before we go, how can people learn more about what you do or follow you?
They can go to wellville.net, and they can write to me at, they can direct message me on Twitter at eDyson. And I'm just explain who you are or why, and mention Dave Morgan's name, and I'll respond.
Very good. Esther, thanks so much. Thank you for giving us so much of your time today, and good luck to you on all your projects, and stay well. And thanks to all of you who have been watching here today, and for all of those especially who asked questions. I really, really appreciate it. Your questions make this program so much more lively and interesting for everybody else who's watching. So with that, we adjourn. Again, thanks so much to all of you. Stay safe, be well, and we'll see you next time on Simulmedia Live. Bye-bye.